Greetings. Welcome to Arizona's Vision. Dr. Mark Page here, one of the chief optometrists at the office in Ahwatukee. Today we're going to do a little more analysis of the OptoMap, and this is inside of a patient's eye. So this kind of gives me a little three-dimensional perspective. So it's kind of like a virtual reality camera. So traditionally when we look into the eye, the pupil reacts to light. So it gets smaller, so my view in there, it's almost like looking into a closet through a keyhole. So I can see the back of the eye, but I can't see the top, the bottom, or the sides. So I look in here and say, well, that looks okay, so you're good. But as we zoom in, sometimes that's not always the case. So I kind of repeat the process here. We can see the optic nerve, and that's what connects the eye to the brain. And then it's a little darker right in the center. That's what we call the macula. And we see all the blood vessels back here too. So certain patients like diabetes or high blood pressure sometimes will actually see bleeding in the picture here as well. So I've got a few other examples here too. So this one is always kind of interesting. So we see a lot of blood vessels back here, but they're not actually leaking. It's just they're so visible because this patient is albino and they don't have any pigment. So the blood vessels which are behind the retina are very visible to us now. So there's not really an effective treatment at this point in time, but it's something that probably won't be progressing. Now we have some other conditions that we can see. In this instance, there's a little bit of cloudiness here. So if we run the fly through here, and I can remove the image itself, so we can see there's a little lens behind the pupil. So as time goes on, that lens can get cloudy. So that can kind of turn into a cataract. So when we're trying to look into the eye, it's kind of hazy back there. But if you're looking from the inside out, it's kind of hazy out there as well. So if you are having trouble focusing, if your eyes are changing, especially trouble seeing at night, that could be the beginnings or the early stages of the cataract. So if you'd like some more information, or you'd like to come and help us take care of your eyes, we'd be glad to help. So go ahead and give us a call. Don't delay. Call us today.